Hi, my name's Mariah. I'm a level 2 nursing student from Conestoga. I'm going to be your nurse today. And today we're just going to be inserting a catheter since your doctors mentioned that you've been retaining a bit of urine. Can I have your name? Okay, now I'm just going to check your ID badge. And can I get your date of birth? Okay, perfect. Now I'm going to start my procedure. Do you have any questions? So I'm just going to perform hand hygiene, and then I'm just going to have you lying on your back, legs distended, and your thighs abducted. I'm just going to drape back your sheet, and I'm also going to put this blue absorption pad just under the legs to catch anything extra. All right, I'm just going to be opening up the catheterization tray now. Okay, I'm going to be setting this pad down, just touching the 1-inch border around the outside edges. Just going to place it underneath you there. Now I'm opening up my gloves. Now I'm going to be draping the penis with this diamond sheet. And I'm going to finish getting out the rest of my supplies, putting them on the sterile field. So I'm going to open up this sterile catheter. And today we are putting in a 16 sized catheter. The reason for the size choice is you're an adult male and there's no hematuria or clots that are present, so we don't need to go any bigger, and since it's an adult, we don't use a pediatric size. And now I'm going to pour this iodine solution over my cotton balls, and I'm going to clean the outside of the penis. With my non-dominant hand, I'm holding the penis and I'm going to go in a circular motion around, discarding the cotton ball after one use. And I did that 3 times. So now I'm going to take the catheter out of its packaging and I'm going to lube it up so then I can insert it. I'm going to insert the catheter at about 2 to 3 inches to lube it up. Okay, now that it's lubed, with my non-dominant hand, I'm going to hold the penis up, take the catheter, hold it a few inches back, and insert it. Just before I hit the bladder, I'm going to move this tray closer so that any urine will discharge into there. And I know I've hit the bladder when urine comes out. So there's urine coming out, so I know I've hit the bladder. So now I'm going to fill up the balloon with a 10 cc syringe. I'm only going to fill up the balloon 5 cc's because the type of catheter that it is holds 5 cc's. Okay, so now that the balloon's pulled up, I'm just gonna pull back until there's some retention. And there it is. And so now it's ready to be attached to the bag. Okay, so now I'm grabbing the bag. I'm gonna attach it to the end. Now that I have it on, I'm going to look for a spot to put it on the side, anywhere below the hips of the patient, and on something that doesn't move. So now that I have the bag set up, I'm going to attach the catheter with tape to the patient's inner thigh. So now I'm going to be cleaning up my workstation. Throwing these in the garbage. And I'm going to wash my hands, not use hand sanitizer since I've been dealing with bodily fluids. Good morning. Your doctor's ordered for you to discontinue your catheter. You're starting to mobilize more and you're retaining more than 30 mils of urine. And I'm going to put down this blue pad just to catch any extra drippings that may come out. And so now I'm going to use this syringe and I'm going to deflate the balloon that was originally inflated. It was inflated 5 cc's, so I have to make sure that that's how much I take out. So now I'm going to pull it out, coiling it around my fingers and pulling it out like that. And so now I'm going to take the bag. If it's full, I'm going to discard it into the toilet and get rid of the cow. I'm just going to clean up my workstation, get you covered back up. And I'm going to wash my hands, not use hand sanitizer since I've been dealing with bodily fluids. Okay, so now I'm going to open up the catheter so that the catheter can stay in place. Just came out.